Hi, welcome back. So I'm Dr. Das here. So today I'll be talking on a very important and common problem, and that is Bell's palsy, which is also known as facial palsy. So this is something we are seeing lots of patients, and they usually come to us and saying that I have a stroke, and this is not exactly a stroke or a paralytic attack, which usually use the term paralysis. But this is of course a paralysis, but it's a peripheral paralysis of the facial nerve. So it's a peripheral cause of facial nerve palsy. And so in this video we'll be talking on why this happens and what are the cause, is there any risk factors, and what are the options of treatment we have, and what is the chances of recovery we can have if somebody is having Bell's palsy. Well, so as I say, the Bell's palsy or facial palsy usually happens in one side of the face. So although it can happen bilateral by both sides of the face, but it is very, very uncommon, and usually happens in the one side of your face. And what happens that the person is absolutely fine, and within an hour or so he or she develops there is some drooping of your angle of mouth, so something drooping here, and the face is deviated. Supposedly drooping is on the right side, and there will be face and angle of mouth will be deviated to the left side actually. That's one thing. And number two, there will be difficulty in closing eyes if it is progressing. If it is a severe one, so the person will not be able to close the eyes properly, so there will be half open eye when you try to close your eyes. Then there will be shagging of your eyebrows. And if you look closely, you find that you see this is the nose, and then this is the face labial part. So nasolabial folds. So there is a mark here, right? So this mark is obliterated, so you don't see. So there is obliterations of this nasolabial fold. And in addition to other things, so if the persons try to drink water, there will be dribbling of water here. There will be difficulty in chewing because the food will get stuck here in between your teeth and the cavity. And in progressive cases, we find that the person will have difficulty in tasting. So there will be loss of taste sensation, primarily in the anterior part, in the front side of your tongue. And then there can have a hyperacusis. That means that sounds may very mild sound may appear very large, louder one. So the prominent symptoms, as I said, the prominent problems which people usually can see is this: there is a drooping and the difficulty in closing eyes, and the facial deviations. So these are all problems which happens, and this happens over hours to days, I will say, if the disease is progressing, and usually happens one side. So the concern, as I said, that whether it is a stroke or not. So this is not a stroke. This is an peripheral seventh cranial nerve, which supplies the face. There is a paralysis or palsy of that nerves. And the question is why it does happens. So usually the cause is a benign cause. So saying benign, I mean that more than 90 or 95%, I will say, with treatment there will be complete recovery. Over weeks to months there will be complete recovery. And the cause is like usually it is found it's a post-viral infections, so like herpes infections, either herpes simplex or sometimes herpes zoster can give rise to. So it's a viral infections which causes this facial nerve paralysis. So how it does happen actually? The facial nerve which comes from the brain. So we have a brain and then brain stem from which all the nerves which supplies our face. Okay, starting from eye, facial muscles, and all the other muscles, starting from sensation to the movement muscle which carries the motor fibers. So they comes from the brain, right? And the facial nerve is the seventh cranial nerve, as I said earlier. So it comes from the brain stem, and it passes through the bony canals. So there will be bony canal, very narrow canals through which the facial nerves comes and then supply the face. So if there is any swelling of the nerves or any inflammatory process because of some immune mediated or some inflammatory responses happens because of secondary to infection or some other causes, which leads to edema. In simple term, I will say the edema or swelling of the nerves in the bony canal, right? So within the bony canal, the nerves passes and there is a swelling of the nerves within the bony canal, and this most commonly happens in one part of your bony canal, that is called labyrinthine part in medical terms. So we say there are multiple segments of facial nerve while they pass through the bony canal. So in simple way, so there is the facial nerves, there is swelling of the facial nerves, there is edema of the facial nerve, there is an inflammatory process, and which causes compression of the nerves, right? And this is usually because of some viral infection, commonly by herpes, and which causes your nerve pulse paralysis, 7th nerve paralysis, and causing this problem. So as I said, these are symptoms, these are the problems which will be there, and this is the etiology, this is the usual cause. Then comes, is there any risk factors? Is there any some particular age group or particular community or something who will having more this sort of infections? We don't have that sort of literature does not say. There is no any significant risk factors other than there is some associations which is being found, like during pregnancy, primarily third trimester near the delivery time, or postpartum after delivery can have this facial palsy. One of the hypotheses which is being given is that because of fluid retention in your body, the chances of getting the facial nerves getting compressed because of edema around that nerves. So one of this one. Another thing found that patients who are having diabetes can have relatively higher risks of this facial nerve palsy or Bell's palsy. So if these symptoms happens, and you might be very concerned, because it's naturally you should be also concerned, and it's a appearance, facial appearance becomes very changed, and you don't feel okay, neither myself, nobody will feel okay, So this is a concern for everyone if somebody is having this problem, because this is facial appearance changes, you have difficulty in chewing, you have difficulty in tasting, and so many things. So what is the treatment options we have now? So the treatment is, as I said, with proper treatment and exercise, there will be more than 90-95% chance of complete recovery within weeks to months. You have a complete normal appearance of your face, and you can have a normal life there. Next question comes, is there any chance of recurrence? Well, the chances of recurrence, we cannot deny that, but chances of recurrence is very, very less, and usually happens if there is any underlying, some inflammatory process. Say for somebody is having sarcoidosis, somebody is having other immune mediated mechanism is going on, so can have recurrence, but usually these are benign conditions and can have improvement again. So in my next video, I'll be talking about facial exercise in addition to the treatment, because what are the treatment we'll be giving, which consists of some antiviral medicines, some medicines which will reduce the swelling, the inflammatory process surrounding the nerves, and in addition to that one, the physiotherapy and facial exercise is very, very crucial, I would say. So some of the facial exercise you can actually do at home, which are very simple and easy to do, and should be and have to be done, should be practiced for a early complete recovery. So we'll be talking on the different facial exercises in my next video.